Bismillahirrahmanirrahim. I am Professor Mulazim Hussain Bukhari, speaking from Pakistan, Muzaffarabad, Azad Kashmir. And it is my pleasure to share my ideas to my brothers and sisters living in Austria and in Germany. Thank you very much, Nisar Bhai. You invited me to speak, you prestigious brothers and sisters. Today, I will try my best to highlight the different aspects of the Omicron. What is the Omicron? What are its effects? What are the peoples who are at risk? What is the booster dose? Why we should take the booster dose? What is the reinfection? What is the breakthrough reinfection? So I will share my screen. Omicron. Omicron is the new variant of this SARS CoV2. It is not a new strain. It is a similar strain with 50 mutations. Some of the mutations are unstable. Some of the mutations are stable. Some of the mutations are similar with the Delta, and few of the mutations are different. Some mutations are, some of the amino acids has been deleted, and one of the amino acids has been added in this Omicron. And the addition of this amino acid is from the influenza virus that is called ETE214. This amino acid has made this Omicron similar to the influenza virus. One thing. Second thing is this Omicron is not the last variant of this SARS CoV2. This is the characteristics of RNA virus, that when the RNA virus changes the host and enters from one host to the other host, or from one cell to the other cell, it makes, you all know that it proliferates in the cells and makes multiple copies. And sometimes the one or two copies are, maybe so many copies are different from the original mother virus. There may be 3-4 possibilities. One possibility is the virus, the new copy of virus may be more dangerous, and if it is dangerous, it will not spread in a longer way. It will not spread globally because it will cause more mortality, more hospitalization, more quarantine, and it will finish. The second possibility is that the virus may be unstable, and if the new variant is unstable, it will go away. And the third possibility is that the virus is similar, but it has some different characteristics due to presence or the absence of the different amino acids. And similar is the Omicron. Omicron is the coronavirus with some different features. We will discuss in the future. And the virus, this initially came from the bat, from the animal. It's zoonotic. The initial host was bat. From the bat, its transmission was towards the human, and when it entered in the human, it became the human virus, and now it is circulating as a human virus. Very smaller, tiny creature that we cannot see with our eyes, even we cannot see from the microscope. We have to use certain molecular aspects to detect its genes or detect its PCR. That is called the real-time PCR. And if you want to see this minor creature, this minute creature, we have to use the electron microscopes. So this minor and the minute creature has created a lot of threats to it, to a person who is millions times greater than this one and this creature. But don't worry, brothers and sisters, you are unique. You have a unique immune system. And Allah has created you for a unique purpose, and you will be here until unless you will complete that job. So let's move. Our first question is that who is more at risk from the Omicron? This is a study from the California on 70,000 people that I will show if that what are different risk factors. But as a scientist, as an optimistic doctor, pathologist, this is my thinking, this is my idea, I may be wrong, that from the last 2 years, we are facing the waves. We Pakistani are facing 5th wave, you may facing 4th wave. And every time the wave is due to some new variants, and every time the consequences are mild. So that is why this Omicron, once it passes away, it will become a flu-like conditions. As I told you, there is insertion of amino acids in this Omicron. That insertion of Omicron has taken from the flu. And the flu, this will be the last virus of this pandemic. And the corona will remain forever like a flu virus. And this will become endemic. So once the Omicron passes, COVID-19 will be more likely seasonal flu and maybe he did far rapidly drop. So if you are infected, what strategy should be adopted? Basically, strategies are being adopted by country to country. NCOC of the Pakistan has made certain SOPs. Every country has its own SOPs, but some are the common SOPs. So as a strategy, if you are infected with the Omicron, because the world is global, the rate of spread of this Omicron is double as compared to the Delta virus. The speed, in other words, the speed of this is, if the speed of the Delta was 100 kilometer per hour, 100 kilometer per hour, its speed is 200 kilometer per hour. Another thing is, as a scientist, the rapid is the more, if the virus or anything is spreading rapidly, it will be less dangerous. So same is with the consequences. So there are the 3 strategies. Strategy 1, if you are unwell, is the different strategy. If you are sick, are you mild, moderate, stay at home. If you are severe, you should be hospitalized, inform to the doctors, go for the real-time SOP, real-time test, and start the treatment according to the advice of your physician. In the second strategy is, if you are asymptomatic, but you are positive, there is a different strategy. And if you are exposed with a person who is suffering, who are coming from abroad or who is here suffering from the Omicron, you should have a different strategy. Return to the work, timing after a positive COVID test, isolation time to 5 days after positive RTPCR for the COVID test. May be different in other countries, but in our countries, if the test is negative or if you have been exposed and are asymptomatic, you may return to the work immediately without fever or significant respiration symptom. in the Omicron, the symptoms are similar to the COVID, the flu, like the flu. But this is a winter season. You may confuse with the flu. If anybody is suffering with the flu, he or she must go for the PCR test that either he is suffering, the person is suffering with Omicron or is flu-like, because now it is confusing for everyone. So these were the three strategies. Another thing is that other question raising that either this new variant is does the Omicron new variant shows up on COVID test responding to the PCR? Yes, the available commercial diagnostic PCR polymerase chain reactions and antigen COVID test still appears to work to identify the Omicron variants. The sensitivity specificity of the PCR was not 100%. Previously, similar 60 to 60% it's percentage, but HRCT is another test. If you are going in severe conditions, you should go for the HRCT test. But PCR is still detecting this variant. It means this is not a new variant strain. It is not SARS CoV2. It is still SARS CoV2. SARS-CoV, what was the difference between SARS-CoV-1 and SARS-CoV-2? There must be more than 20 to 25% difference in their amino acids. Percent, not number. This is you should not confuse the 50 amino acid does not mean 50%. It hardly makes 1 or 2, 3%, because there are, this is a longer longest amino acid for 30,000 base pairs, and each base pair, 3 base pair wins 1 amino acids, around about 10,000 amino acids, and only there are 50 amino acids change. Do not be worried. This will not create a bigger damage, or this is not a burden on the healthcare system, or this one thing. Another question commonly coming in the brain of the physician, that this new Omicron, will this respond to the monoclonal antibodies? Because previously almost Delta was responding about 70% of the sensitivity, efficacy of the monoclonal antibody was 70%. So I will say that yes, certain type of the monoclonal antibody, Sotrovimab, found to be the effective in treating the Omicron variants. What is its ethical effects? It preventing severe illness and the mortality. This monoclonal antibody will prevent the severe illness and the mortality. This will reduce the strain on our healthcare system and the resources, especially developing country in Pakistan. So we can better care on our community. So this is why this monoclonal antibodies should be used for the treatment of this patient if physician see that it is going in a hospitalized, going to the another therapy as was being used, dexamethasone or vitamin D, or they're almost similar, and remdesivir, all these similar, but two more antiviral are, I have made them red. Paxlovid, this is due to two combination of two antivirals, and one other molnupiravir is another monoclonal is another antiviral that is more effective and approved by the FDA. Both these are monoclonal antibodies are given in the hospital, while these should be given. These antiviral should be given. Both these medicines are intended to avoid progression to hospitalization and the mortality from the COVID, Omicron, and are thus positioned to be used in the outpatient setting. So the treatment is similar if the patient is hospitalized. If it is in the mild to moderate, stay at home and it will automatically finish. Another question to the COVID vaccine will still work and reduce the risk of the severity. These are the multiple questions, and there are multiple myths in not only in the Pakistan but all over the world. There are so many people who are anti-vaxxer. There are so many hesitations in the use of the vaccine because this vaccine was new and the vaccine is similar to the drug and was showing some reactions and some side effects and some allergies. What are different questions? I will address one by one. What is the definition of the booster dose? Why should we recommend the booster dose? Which vaccine should be used for the booster dose? What about the Sinophar and Sinovac after completing the 2 doses? Because in Pakistan, we were using Sinophar and the Sinovac. Can one get 2 vaccines, flu and COVID? Or one another commonly asked the questions that can one get the vaccine of 2 companies? So I will address one by one. First, what is the definition of booster dose? It means if anybody has completed the schedule of any vaccine, 1 dose vaccine or the 2 dose vaccine. Suppose Moderna 2 dose vaccines, Pfizer 2 dose vaccine, Sinopharm 2 dose vaccine, Sinovac 2 dose vaccine, AstraZeneca 2 dose vaccine. And if anybody has completed the vaccine, these vaccines are recommended by the FDA for the emergency use. Only the Pfizer has been recommended. If any person has completed the schedule of emergency schedule of the emergencies based emergencies registered vaccines, and after some time, after 6 months or after 9 months, or the person who is autoimmune, if the person is autoimmune the patient suffering from the autoimmune disease, so he or she will need another dose to boost their immune system. Booster dose is of same company. If you have taken already 2 doses of Moderna, you must take booster dose of the Moderna. But 1 dose, but not again the 2 dose. One thing. If somebody has taken Sinopharm or the Sinovac, and he or she want to get the booster dose of the Pfizer or the Moderna, he must take 1 dose, not the 2 doses. Because now this is not the schedule, this is taking the booster dose. This is much confusing in Pakistan. The people are taking again 2 doses of the. So if you are going to take the booster dose, you take the 1 dose. Or if the similar company, or if the 2 different companies. If you are taking the booster dose of the different company, it is called mixing and matching. What is the mixing and matching? The study shows that gives a better response of the production of the antibody, neutralizing antibody, and the T cell response as compared to if you take the booster dose of the similar company. One thing. So why should we recommend the booster dose? Booster dose are recommended when there is another wave, a new wave of the similar infection, or some person says that due to some comorbidities, he or she is reducing the neutralizing antibody. But unfortunately, here we are only detecting and believing the neutralizing antibody. We cannot check, we are not believing on our another immune system that is called the T cells. We cannot detect the T cell. T cell, the cellular response. When there is infection or when there is vaccine, our two immune system starts working. The B cell make the antibody, while the T cell or the natural killer cell, they are ready to kill the virus or the bacteria or the microorganisms themselves. So when there is no infection, when the person is infection free, these cells become the memory cells. And when they are memory cells, they will go sleep. But whenever there is reinfection, they will awake again. And awaking takes almost 3 to 4 days, depending upon the immunity. I will discuss this point in the question of reinfection and then the question of breakthrough infections. So this was the answer of the why should we recommend the booster dose? Which vaccine should be used? I will say get the vaccine which is available. And for the booster dose, if you have already used the Sinovac and Sinophar, go for the single dose of the Sinovac and the Sinovac. I have also answered these questions. Last question, can one get two vaccines? Yes, in the childhood, we have taken MMR. We have taken combination of so many vaccines. So this is a winter, this is the season of the flu. We can take two vaccines, flu vaccine and the COVID vaccine. So this was about the. So another question, these are the same question that I have already given, that the WHO has recommended booster dose on the 7th December 2021, and the Pakistan has also recommended the booster dose over the 30 years, while in the developing country, they are giving the booster to all ages. Yes, they can concurrent of the influenza immunization, that is called Florona, because the people are suffering with two viruses at the same time. Pakistan has also recommended this one. What is the definition? I have given the definition of this. Why booster dose? Yes, I have given the detail previously. This evidence happening. Yes, this one. As I told you, with the passage of time in every person, their memory cells sleep and they do not produce the neutralizing antibody because there is no infection. Similar, when the war is over, the army men go in the barracks. There is no need to come on the borders. So similar, our armies, B cell or T cell, they go back to the rest. So that is why the people say that their level of neutralizing antibody is decreasing. This evidence is mostly based on the observational studies. That may be subjective to confounding factor. Yes, depending upon the disinfectant. Now the question is that, is there a chance of reinfection? What is the definition of the reinfection? A reinfection means if a person is suffering from a coronavirus of any variant and he or she recovers and gets another infection after 90 days, that is called reinfection. Yes, as I have told you that our immune system, memory cells, sleeps after the virus is over. So it takes 3 days to 4 days in activation of our memory cells. So during 3 days, during 3 or 4 days, the virus can attack, and this can appear in a reinfection. But if the person is suffering with comorbidity, the reinfection can be severe. The patient can be hospitalized, or the patient can be show certain other ICU or something else. And another question is, can there is a breakthrough means that if a person is fully vaccinated, can he or she get a reinfection? Yeah, infection. Yes. Again, the similar answer that if a person is immunized in the spike protein in a spike against the spike proteins, our neutralizing antibody remain active maximum 90 days, minimum from 90 days to 3 months to 6 months, and with the passage of time, it start declining. So after 9 months, if there is, because the virus is all around us, circulating, we cannot stop the virus. When the virus will enter inside, through our nose, and we will inhale, before the activation of our immune system, the virus can show same sign and symptom. This is called the breakthrough. So reinfection is possible, breakthrough is possible. Then you can ask Bukhari Saab, then why should we, if these two processes there, then why should we take the vaccine? The answer is that the vaccine will protect you from going to serious condition. The vaccine will protect you going to the ICU. The vaccine will protect you from going the ventilator. The vaccine will protect the mortality and morbidity. And so this is, you can ask from me, Bukhari Sahab, does the Omicron cause more serious effects? I will say no, because now we have enough data. This is the study from the California, 70,000 patients. I have compared from this study on both sides, hospitalization, going to the ICU admission, the rates of morbidity, mechanical ventilation, and median hospital stay. 2 variants, the Omicron has reduced, showing much better effects. No doubt, its spread is like tsunami. Its spread is rapid, but its consequences are not severe as compared to the Delta. So this is the evidence-based study. So this is also comparison this is the comparison of 2 viruses. This is the Delta, and this is the Delta, and this is the Omicron. So from admission to all these deaths, this is a much better relief after the infection of the Omicron as compared to the Delta virus. So there should be no worries. You should use the SOPs. Do not close the border. Do not make the restriction or something else, because it will create a lot of burden on our economy. Do not put the lockdown, do not close the schools, but only concentrate on the SOPs and the vaccinations. In the beginning, there was a question in the beginning of my lecture. There was questions: which people are at risk? I have compared this. This is the similar study from the America, California. Age, the Delta virus was less affecting, Delta virus was affecting less the children, but this virus is affecting all ages. The sex, both viruses affect the males. Why? Because the males are more socials, they go more in the activities, they are careless. The females are more protective, they remain more at home, and genetically their immune system is stronger until and unless two groups of the females are at risk. One is the mothers who are lactating but not getting the vaccine. There was hesitancy that lactating mother should not get the vaccine because she is lactating, and the vaccine will pass through the milk and can change the DNA of the child or their baby. So this was just a misconception. The virus cannot pass through the milk. The milk, it has been tested, the milk is free from the viruses. Mother milk is free. If the mother is infected with any type of the virus, hepatitis C, hepatitis B, coronavirus or any virus, her milk is free of the vaccine. Her milk is free of the virus. That the mother should give the milk to the to her babies. And if the mother is vaccinated, there is dual effect, beneficial effect. The antibody will pass through the milk and the baby will be protected. The second group of the females are at risk, who are pregnant mother and they are not taking the vaccines. Again, there was a myth of misconception that this vaccine will pass through the placenta and that will change the DNA of the babies. Newborns, we have seen so many healthy newborns, the mother were pregnant, mother were vaccinated. So the mother must be vaccinated. The pregnant mother, if the pregnant mothers are vaccinated, the antibody will be transformed from the transplacental and will go to the babies. We have seen babies of a pregnant mother after their delivery who were vaccinated. The antibody was present in the babies till the 6 months. So the babies are also protected. Another risk factor is the race and ethnicity. The blacks are more at risk. Another, shortly I will go on the body weight. Obesity is another comorbidity. Diabetes is another comorbidity. Autoimmune diseases are another comorbidities. Hypertension or another comorbidity. Stress, worries, these all things reduce the immune system's activity. That is why these are on the risk. These people are on the risk. Similar, people who are healthcare workers, they are more exposed to the patient. They can get the infection. So the question is that it is true that the Omicron is different from the Delta virus. No doubt. Its infectivity, regarding its infectivity and the severity. Infectivity is rapid while the severity is low. It is similar to the bullet train of the Japan. Its similar, its infectivity is similar to the bullet train of the Japan. Its infectivity is similar to the tsunami, but its severity is low. What will be the consequences of these two features? I will discuss that in the last slide. Though the Omicron has high infectivity, but it's too much less severe in mortality and morbidity. It is not much worrying for those who are double vaccinated, who are young, good immune systems, and who are elderly without comorbidity. They are controlled diabetes, low blood pressure, they are good on, they are taking proper exercise, proper diet, and something else. Same if it is a bullet train, if it is tsunami, what can its cause effect on the? Then a huge number of population will be infected at the same time. And if a small percentage with comorbidities and those who are not vaccinated will not be able to fight out the virus leading to the severe disease, they will requiring the admission in the hospital. They will need the medical treatment. They will need the oxygen therapy. What will be the effect? If the burden will increase, even a small number of infection, but their load is increased. If Pakistan, 220 million peoples are there, and if a very small number of comorbidity people are there, and if unvaccinated people are infected, they can paralyze the system. This will definitely put the heavy load in the hospitals, and they may paralyze the healthcare system everywhere in the country. This is the dark side of the spread of the Omicron. The Omicron, like the wildfire, which you can see in the USA and the UK. This is the thing that we are working on it, that the Omicron can cause this. So what should we do? How can we spread? This is only to adopt the follows, please, strictly, my brother and sister, my students, my friends, please strictly follow the COVID appropriate behaviors. Go for the vaccine, go for the booster dose. Wear the mask, adopt the social distancing, wash the hands if you meet each other. Take good balanced diet, take the proper sleep, do the physical activity. If you in the winter cannot go outside, you can do physical activity, play at least 30 minutes indoor activity. There are so many indoor activities. And namaz is the best physical activity. These things are very important to keep warm your immune system. And if your immune system is warm up, then there is no danger of the vaccine. There is no danger of the spread of the Omicron. And thank you very much. If you have any questions, most welcome. Thank you very much, Nisar Bhai. Thank you very much, Waji Bhai. And thank you very much, my brothers and sisters of the Austria and the Germany chapter. Congratulations that you have developed this new group. And it is my pleasure that I am presenting my these small words to my highly developed country, brother and sisters, scientists, researchers, healthcare professionals from the community leaders in this group. And I pray at the end, may Allah keep you safe from each and every disease, the disease, physical disease and diseases of the soul. And I will pray for you all that may Allah protect us and protect the humanity and protect the people from this pandemic. Thank you very much. Most welcome if you have any questions. And you can ask question if I have not addressed some other important issues of the Omicron.